The goal of the master's program in prevention science and community health is to train the next generation of researchers and practitioners who are committed to reducing morbidity and mortality through addressing preventable behaviorally based causes. Some of the issues that we address in this program are things like diet, physical inactivity, drug use, risky sexual behavior, gun safety, motor vehicle accidents, so just behaviors that really would get people to promote health and also to save their lives.
We're faced with challenges every day in prevention science, and we really need people who can think on their feet and apply the fundamental tenets of prevention science to create better wellness, better health in our communities and in the world.
The sequence of courses is really nicely organized so that they understand etiology, meaning risk and protective factors. They understand how to take those risk and protective factors and develop interventions that address them. And then they also understand how to disseminate and implement these interventions so that they land where they need to be, which is in the community.
My interests were obesity prevention and physical activity promotion, so focusing that thesis on those things during COVID-19 helped me morph together everything that I had been learning. And I created an animated video as a brief video intervention as part of my thesis. A lot of places throughout the United States are seeing it and responding that it's helped them a lot, and it's so cool to see how one thesis project is actually helping and making a difference.
I really admire how you can tailor the program to your own goals and needs, and I also really love how involved the mentors are in terms of keeping track of where you are and also giving us ideas about how we can better tailor our tracks to our lives.
Mentoring for me is hands down the most rewarding aspect of my career. I love it. And I love to really get a student, figure out what their strengths are, figure out what their goals are, and then tailor the experience so that they can capitalize on their strengths and get to where they want to get.
So really part of the learning process is experiential. It's talking to people out there in the field, and really there's no substitute for experience and actually getting out there and doing it.
The community is our lab, and we're housed in a very interesting, diverse lab.
It teaches you the basics of prevention science and community health and lets you take your personal interests and make a program that kind of fits all of that, and you can come out with a degree that you can follow your personal dreams with.
Students have actually gone on to pursue medical school after our degree, but then students can also go on to pursue jobs in government, in nonprofit sector, in industry, to figure out how to utilize the skills that they've gained in understanding how to translate research into practice in a very real way.
My end goal is to be a dermatologist, and I really want to focus on preventing skin cancer, especially focusing on minorities. So that's really something that I want to make a big part of my career, and I thought that prevention science would be the perfect program for me to do, to pair that with my medical degree, and then I'd be able to come at the issue from a public health-minded perspective.
This program is the most relevant to the public health moment that we're living in today. A lot of what we're seeing right now due to COVID-19 and a lot of the mitigation strategies that we have are ultimately based on people's behaviors. And so one of the things that we try to do is really understand behaviors and understand how to motivate, move, change through the interventions that we've designed to understand what the mechanisms are, what the drivers are, and then how to get those interventions out into the community.